in the intense world of medical emergencies.
One patient, 3 times stab wounds.
There's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pals.
Here, where time is critical, lives will be saved. On roadsides, in back gardens and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll, ready, steady, roll.
Tonight,
This lad's just ran out across the road.
a boy is run over on his way to school.
Can you move your right arm?
A woman suffers a horrific open ankle fracture.
Nice deep breath,
Well done.
Sandra. That's it, well done. Nice deep breath.
A horse riding disaster,
On the left, on the left part of my neck.
Yeah.
and a man has a cardiac arrest in front of his daughter.
So what I'm going to try and do, I'm going to give him some sedation and potentially paralysis as well, just so that we can look after all of his breathing. Hello, are you all right? How you doing?
Critical care paramedic Pete Edwards joined the ambulance service 15 years ago.
Just thought I'd give the car a bit of a clean. Looks nice when it's clean, so...
5 years ago, he underwent specialised training and is now a member of the critical care team.
Nearly done, sorry.
The critical care team rely on their fleet of high-performance vehicles to get them and their specialised equipment to an emergency in the quickest time possible to provide vital life-saving backup to the ambulance service.
This bag, the red bag, or bag 1 as we sometimes call it, is our enhanced care bag. So it's got some equipment in here that they don't carry on the ambulances, and that includes sort of surgical equipment. We've got some advanced airway equipment, extra little bits that the ambulance crews don't tend to have.
Ambulance services, the patient breathing.
This lad's just ran out across the road and I've hit him with the car.
Okay. Where's the pain that he's feeling?
Where's the pain? In his leg.
Is he in the road still?
Yeah, we're in the road.
You're okay, left. 13-year-old Patrick, hit by a car, patient is still in the road. So, yeah, we haven't got a huge amount, we've got an age. The rest we'll have to figure out once we get to scene.
An ambulance has been dispatched, but with the child's life in danger, Pete and fellow critical care paramedic Mike Andrews are also urgently needed.
We'll be there first, won't we, brother?
Yeah, we're going to be the first resource on scene, which is a bit unknown at the minute.
In a 12-hour shift, Pete and Mike will attend up to 8 emergencies. Their skills and training can make the difference to someone surviving or not, but only if they get to them in time.
That's completely blocked that way, Mike, by the looks of it. Some of this might just be general traffic, I don't know, or it could be because of what's happened.
In these freezing conditions, Pete and Mike will need to act fast to stop the child's injuries becoming critical.
Can't go the wrong way around in the dirt as much as I want to. I'm going to park us just in front, okay?
I'll press us in attendance. Mike, shall I get out and jump and have a quick look?
8 minutes after receiving the call, Pete and Mike are on scene.
Morning, how you doing? All right? Hello, Patrick. Hiya, mate. I'm Peter. I'm one of the paramedics with West Midlands. Are you Mum?
Yes.
Hello, Mum.
Listen.
13-year-old Patrick was walking to school when he stepped off the pavement into the path of an oncoming car.
We're going to have a look at him. We're going to look after him for you, all right? We've just got here ourselves. He's talking to us. That's a good stop. Are you hurt?
Just not here.
Just your ear? OK, let's just have a quick look.
It's common in car versus pedestrian road traffic collisions for the pedestrian to have sustained multiple injuries. Using their enhanced trauma training, Pete will need to assess him quickly to prioritise treatment.
Can you move this arm just gently? Yeah, you can move it. Can you move your right arm?
Shoulder.
Your shoulder hurts. And what about your legs? Can you move it a little bit? Don't move it too much, as long as you can move. OK, all right.
Patrick is able to move his arms and legs so Pete can rule out a serious spinal injury.
OK, all right.
But the blood coming out of his right ear is a major concern.
It's a hemorrhage just out of his ear. I'll give him an update, mate.
All right. So potential for a base gun until we investigate it further.
Pete and Mike suspect Patrick may have fractured his skull, resulting in a build-up of blood in the brain. If so, he's at grave risk of a stroke or potentially fatal hemorrhage.
Happy to pass an ethane.
Yeah, mate.
Crew on Red back up, just to see we'll get him out the cold, all right?
The Midlands Air Ambulance service covers a region of 6 counties and 6,000 square miles, the largest operating area in the whole of the UK. Each helicopter is crewed by a pilot, an emergency doctor and a critical care paramedic.
Ambulance service, is the patient breathing?
Yeah, but she's struggling to breathe. She can't breathe in. She had a fall from a horse.
Okay, she's conscious though.
Yeah, well, we don't know if she was conscious when she fell. She was in shock. She walked round, sat down, she can't move.
Is she bleeding at all?
Not that we can see.
03 lifted with an ETA of 4 minutes.
A local ambulance crew, who are already on scene, have called for backup.
This is a female who is riding a horse at a trot. She's been thrown from the horse and impacted into a concrete step. She presents with quite significant pain. She's slightly hypertensive with a very weak radial pulse, looks very pale. Crew is struggling to get a handle on any sort of analgesia, I think due to her query, slight compromise on her pulse, etc. And have requested some support.
The rider's condition is deteriorating, so the air ambulance has been scrambled, with emergency doctor Matt Rowley and critical care paramedic Karen Baker on board.
It does make you concerned when you hear that someone's blood pressure is low, that they've got a very weak pulse, that they're very pale. It does make you concerned that she's potentially bleeding somewhere. So hopefully we'll get a better handle on that when we get on scene and get to have a look at her.
They need to find somewhere to land quickly.
Just coming into the overhead now.
A fall from a horse, even at low speed, can cause catastrophic injuries.
There are horses absolutely everywhere, but there's a field this side. Just giving it a wide berth because our dog walkers making their way across the field, so hopefully they'll be the other side of the field by the time we make the approach.
The rider could have broken her back or be suffering from a potentially fatal internal bleed.
2-3 on the ground.
Finally on the ground, Matt and Karen arrive on scene.
Rachel. Hello, I'm Matt, this is Karen. Where's the worst of your pain at the moment? Inside your chest. Okay.
49-year-old Rachel, an experienced rider, was turning off the road into a field when a sudden hailstorm caused her horse to spook and she was thrown onto a concrete path.
Can I just have a little feel on the front of your chest, is that okay? Just tell me if it's painful when I'm pushing anywhere.
Her daughter Kelly was with her and called 999.
Where's Kelly? Yeah. I'm here, Mum. I'm here.
Rachel, I know we're asking you lots of questions at the moment, sweetheart. So, when you got up and walked from your horse, did you have any pins and needles in your arms or legs?
I can't remember.
Can't remember, okay.
Dazed and in agony, Rachel can't remember the fall. As well as low blood pressure and confusion, she's also showing an increased heart rate. All signs of potential internal bleeding.
Nothing around there?
No,
Ball in your back, okay, sweetheart.
The pins and needles sensation could be temporary, but but it could be a sign of a serious injury to her spinal cord. Rachel needs urgent hospital treatment.
Let's do that blood pressure again.
But Dr. Matt knows that moving her risks leaving her paralysed.
Is that your chest again, Rachel? Yeah.
This is a patient that's jumped off the bridge, receive.
That's all received, thank you.
The critical care team is available 24/7 to attend to the most serious emergencies, from road traffic accidents to cardiac arrests throughout the West Midlands.
The role's rewarding, I think it's because it is challenging.
It's without doubt a huge privilege to do this job and to have this skill set and the capability to help these patients at the worst time of their lives.
Part of their training is in drugs and anaesthesia, normally only used in operating theatres and intensive care.
Just going to pop a little needle into your arm so we can give you some pain relief, OK?
So in the most critical cases, they can take over the basic functions of the body to keep their patients alive until they get to hospital.
We can obviously put people into medically induced comas and stuff to help manage them.
If we have a cardiac arrest and then manage to get a pulse back on a patient, we carry some extra bits and pieces and drugs that we can add to what the crews do to give the patients a better chance of survival to hospital.
Critical care paramedic Jack Lewis is about to start a 12-hour shift.
It's a drug check day, so all of the enhanced care drugs are bags, because if we all turn up at the same job, we all know what's in all the bags, where it all is. It just makes life a little bit easier.
Ambulance service, is the patient breathing?
Yes.
Is the patient conscious?
Yes.
Ma'am, what's the problem?
He's really struggling to breathe. He's just literally come on really fast. He's absolutely blue here.
Okay.
All right, okay.
Is he still breathing?
Only just. He's gone all stiff on me now.
Is he taking regular breaths at the moment?
No. Dropping at the mouth.
Is he having a seizure?
I think he's having a seizure.
Okay. Let him go with it.
Come on, Dad. Okay, they're coming now, darling. Okay, I've got no breathing.
Okay, roll him onto his back for me. I'm going to tell you how to give life support. They are pulling up outside, but you need to start this, okay? One hand flat in the centre of his chest, put your other hand on top, lock your fingers together. Keep your arms straight, push down, hard and fast, 2 times a second.
Yeah.
I want you to do that until the crew are right with you, okay?
I know.
You're doing a really good job. You're doing really, really well.
Okay, they're here.
An out-of-hospital cardiac arrest is always a code red emergency. Without swift action, the man, 79-year-old David, could die in minutes. The local ambulance crew has called for immediate critical care backup.
This is a crew request for assistance for an elderly man. I think the call initially came through as fitting, but is, I believe, now cardiac arrest. And I think they're struggling with some airway management options, which is one of the skills, enhanced skills that we carry.
Thanks to his daughter's prompt action and the crew's response, David's heart is beating again, but without enough oxygen, his life is hanging by a thread. Jack carries drugs and resuscitation equipment that could save his life, but he's still 5 minutes away from the address and may not get there in time.
Downtime has been, I think, fairly considerable now. I think call time was 20 past 2 and we're now approaching 2:40, so we've had 20 minutes of potential cardiac arrest, so it might be that by the time I get there, actually we're past the point of making a meaningful difference for this gentleman and we go no further. 62. Hello mate, how you doing?
Jack arrives at the address and is immediately briefed by the paramedic team so he can lead the treatment.
We have 74-year-old David.
Hello David.
79-year-old.
Yeah.
Collapsed, daughter says his breathing went funny.
Yeah.
She started CPR. Initially querying if there was a carotid when we got here.
Yeah.
There was a gonal breathing.
Yeah.
He arrested at 14:19.
Okay.
And we got a ROSC at 14:35.
Nice one.
Daughter Caroline, who was with him when he collapsed, has been joined by other concerned family members.
Awesome job.
The paramedics have inserted a tube into David's throat, and he is now breathing with the help of a ventilator.
I'm just going to get some midazolam, and then at that point we'll put him onto my ventilator because it's just a bit better for him, if that's okay.
Jack needs to get David to hospital for urgent tests to find out the cause of his cardiac arrest.
All right, Dad. Nearly done.
But for now, he's focused on just keeping him alive.
David's doing really, really well.
When we get him on the ambulance, we'll just have a few minutes, we'll get him sorted.
Back in Smethwick, critical care paramedics Mike Andrews and Pete Edwards are at the scene of a road traffic accident where a 13-year-old boy has a serious head injury after being run over on the way to school.
Just looking at the car for some indicators of how hard the car has hit him and potentially for injury patterns, really. So where he's obviously gone onto the bonnet, but the windscreen is intact. So he's got a head injury and some bleeding from his ear, so we need to look at that quite quickly.
It's likely Patrick's head would have taken the main impact of the blow, potentially fracturing his skull.
Patrick, do you think you were knocked unconscious at all? No. All right, mate, just have a look, just a second.
Checking his pupil's reaction to light will show whether he has suffered a concussion.
Have you got any pins and needles anywhere? No. OK. All right. How bad is the pain at the moment? Your ear, is that the worst pain? And what about your shoulder? Is it just when you move it? OK, all right, no problem. The ambulance is here now. What we're going to do, we're going to get a proper look at you in there, all right?
Pedestrian, 13-year-old male, struck by a car.
As West Midlands ambulance crew arrive on scene, Mike updates the critical care trauma desk on Patrick's condition.
Query basal skull fracture. Well, the patient is conscious and talking to us. He's just got a bit of a hemorrhage coming from his right ear.
Now the ambulance is here, they need to get Patrick to hospital as quickly as possible.
He's got a head injury. I think we need to, we'll get him immobilised. Yeah. So if you could grab your stretcher and scoop. We haven't stripped him off because he's going to get freezing cold.
Yeah.
So are you all right with that? Is that OK? All right.
Let's do a few little checks on you, OK? See how you're doing.
Peter and Mike need to be sure they don't aggravate any undetected injuries when they move him.
I think without the collar, yeah, but what we'll do, we'll get us, he's moving it, just keep your head nice and still, Patrick, that's it. He's moving his head freely and he's moving all his limbs free, he's got no paralysis. We'll have to get this bag off, I think, so it might be just a case, we'll have a look at that in a second. Has anybody got any shears on them?
Keeping Patrick as still as possible, Pete oversees the ambulance crew as they position the scoop stretcher underneath him.
Any pain in your tummy? Nothing? No in your back? Lower back? That's good stuff. OK. Right. Just let us do all the work, Patrick. OK. We're going to just... There's going to be a little bit of movement, mate.
You're going to feel pinch and sneeze, all right with this?
All right. Now, it might pinch your bum. Tell us if it does and we'll stop.
You got his head just clear of that, mate.
Once the two halves are snapped together, Patrick's head and neck must be immobilised.
Yep. OK, mate.
Before it is safe to move him onto the stretcher.
Got some grazing to the temporal region there. The other thing we need to have a look at is his sort of upper thigh pelvis region, because where the dent is on the bonnet, it looks like that's where it's struck him. Yeah, if that makes sense. So, ready, steady, lift, and ready, steady, down. OK. So that's, you're right. All right, nothing to worry about, we're going to look after you, OK? OK, going feet first, then. What we're going to do, we're going to take some of his clothes off, all right? Yeah.
On the ambulance, Pete can oversee a full body examination. He's worried Patrick may have broken a bone in his pelvis, which could rupture the femoral artery, causing him to bleed out and die.
Take a nice big deep breath in for me. Big deep breaths in. It's clear. It's equal. OK. So I've checked his pupils, they were leaking and reactive right. He's got an abrasion to the top of his the right side of his forehead, and he's got this blood coming out of his ear that I can't see where it's coming from. So in terms of hospitals from here, he's nice and stable, but just because there's blood out the ear, I think sway towards the children's. What do you think?
Patrick is alert and doesn't seem to have broken any bones. Pete is happy he is stable enough to leave him in the care of the ambulance crew to take him to Birmingham Children's Hospital to be further assessed by the emergency doctors. It's the weekend, but there's no let-up in life-threatening emergencies and no rest for the critical care team.
2020.
Critical care paramedic Tom Waters is prepping for his shift.
Saturdays, obviously, more people are off, more people want to do certain things, people are more active. So yeah, I think that could mean a busier day for us. The weather, it's not too bad outside, so we'll see how the day goes, but we're booked on, we're good to go. We've got our drugs out, and it's a bit of a waiting game now.
Ambulance service, is a patient breathing?
Hi, I'm not sure. Literally just seen a crash outside of our house. The car's literally like written off.
Okay, so it's one car. Oh,
Yes, it's one car who's gone into like the wall.
Did you see how fast the car was travelling at all?
It was going quite fast to be honest. Like more than 50.
That's absolutely fine. I am going to be on scene in 30 seconds.
Thank you.
With a car crash in a residential area, there's the danger of multiple casualties. Police, fire brigade and ambulance have been called, and specialist trauma backup is also requested.
RTC, don't really know what's going on, but it's here.
At the scene, a crowd has gathered on the pavement.
Oh shit.
The vehicle, a rental car, has somersaulted into a brick wall and the driver is nowhere to be seen.
Which way did this car come from, do you know? Halfway. Okay, right. And did you all see it? Okay.
Does that catch you anywhere when you breathe in?
In Wolverhampton, Dr. Matt Rowley and critical care paramedic Karen Baker have flown 9 miles in the Midlands Air Ambulance to rescue 49-year-old Rachel, who is in a critical state after she was thrown from her horse onto a concrete path.
Any pain in your tummy?
No.
Good, okay.
What were sats on there?
100%.
Okay.
It was just the fact that capillary refill was a bit swollen.
Okay. Any pain there in your tummy? No, okay.
Rachel's low blood pressure and poor circulation, along with her memory loss and severe pain in her upper back and ribs, is a sign that she may be suffering from life-threatening internal bleeding.
Do you want to take the mask off it now and just see how she's saturating without the mask?
What we're going to do is just have a little feel underneath your neck at the moment, okay?
On the left, you know, on the left part of my neck.
Yeah.
If where the ball is, I've it there as well.
Have you? Okay.
Yeah.
When I'm pushing now on your neck, tell me if you got...
Tiny. No, gone now.
Okay.
There.
There, is that tender in the middle of your neck? Is it where my finger is there? Okay.
Rachel needs urgent hospital treatment, but before Matt allows her to be moved, he needs to be sure she hasn't fractured any vertebrae, which could result in paralysis.
How much morphine she had off your time? Just 5. Should we go for let's go for another 5, and then we can give her another 10 then, can't we? She had any antiemetics yet either?
Yes,
she's had the on-dance charge. Examination's fine. Let's give her a bit more opiates and see how we get on.
Dr. Matt judges the precise dose of analgesia Rachel needs to help her tolerate the journey to hospital without risking a drop in blood pressure that could cause her to black out again.
She'd be good for New Cross.
I agree with you. I think New Cross, you might have something in the right chest. I think we're so close. I don't think she probably warrants giving anything stronger like ketamine or anything.
It's a 9-minute journey to New Cross Hospital. Rachel will travel in the ambulance with her head and neck immobilised in a collar to protect it from any further damage.
Rachel, if your pain was a 10 at the start, where are we now, do you think? About a 3? Okay.
Blood pressure before I get this, so
just give her another 2.5 or something. She's quite comfy, isn't she now? So, initially assessed her on scene. They've been slightly concerned because she's quite pale. Her initial blood pressure is a bit low, and she's got significant pain on the right side of her chest when they're breathing in and out. So, quite rightly, they've been fairly cautious with the analgesia that they're given to start with. Her observations have improved, and that's enabled us to give more morphine.
Right, I am going to go and start loading the motor back up.
Okay.
With Rachel's condition now stable and her pain under control, Matt and Karen leave the ambulance crew to transfer her to hospital.
She's now fairly settled. She's able to take big, deep breaths in and out, and the pain has subsided slightly. So they're going to take her to the nearest hospital from here.
Hiya. I guess it's...
In Dudley, critical care paramedic Tom Waters is at the scene of a road traffic accident.
Hi, buddy, you all right?
Yeah, I'm okay, mate. It's just a few bumps and bruises.
The car somersaulted off the road into a lamppost. Miraculously, the driver, 39-year-old Carl, walked free from the wreckage and is being treated inside the ambulance.
The car is absolutely total, isn't it? It's been through a massive roll, isn't it?
Yeah. And then men flipped like that as well, yeah.
And it was just you in the car,
Just
wasn't it?
me in the car.
And if you hit, I'll go check nobody else has been hit, all right, and then...
According to Carl, the accident happened when he was run off the road by another driver.
Are you happy for me to... He looks absolutely fine, doesn't he?
I don't
like the fact... Yeah, so the fact he's self-extricated, he's walked, he's chatting, his G says 15, he remembers it all. If anything, he can go to low... Oh, there you go. Hey, bud. Are you getting your phone? All right.
Extraordinarily, Carl seems most anxious about his mobile phone.
So basically, the one gentleman is the... he's just getting his bits and pieces out of the car.
Well, how's he done this?
Long story short, rammed off the road, hell of a mechanism. He just wanted to check his stuff, so... All right, bud. Do you want me to have a look for you?
Yeah,
do you want... Yeah, go and have... We'll get... Yeah. Go and have a sit down in the... Take those bits for you.
My phone is in there, it's
okay.
On a 20i light.
Okay, well, we'll make sure we get...
I just need to get it because my mum was on
okay.
trying to ring me while this was happening.
Let the guys just safe it. We'll get it for you. Go and sit in the ambulance. Cheers.
Can I get the phone though before?
Yeah. We'll ask one of those guys. We'll get you the phone. I promise you. But can we get you inside first? What's the... Bloody lucky, isn't he? Yeah. He's really desperate for his phone.
Satisfied that Carl has not been seriously injured, Tom is happy to leave him in the care of the local ambulance crew. In Birmingham, critical care paramedic Jack is treating 79-year-old David, who is fighting for his life after a 15-minute cardiac arrest. Daughter Caroline and other worried family members are also on scene.
So he's had a cardiac arrest. He's had a cardiac arrest that's been prolonged for quite a period of time. Because of that, his brain's been starved of oxygen, even with good CPR. So it's likely that if he starts to try and come around too much, he's going to be very agitated and quite difficult to look after.
As a highly trained paramedic, Jack is authorised to use specialised drugs normally only used by doctors in intensive care in hospital.
So what I'm going to try and do, I'm going to give him some sedation and potentially paralysis as well, just so that we can look after all of his breathing, all of his awareness.
With David barely conscious, Jack must decide whether to put him into an induced coma to protect the vital supply of oxygen to his brain and organs.
OK, so he's had 3 milligrams of midazolam. He's had that now at 14:48.
If he has another cardiac arrest while he is under full sedation, it will be much more difficult to resuscitate him and he may die.
Yeah, so eyes are open, but he's not really responding to you. He's localising, so that's a 5. Yeah. Ben, can I have a conference call, please, with senior cover to discuss some rock?
Rocuronium bromide is a fast-acting muscle relaxant normally used in operating theatres before major surgery.
Hi, Neil, you OK? Good. Thanks, mate. So I've got a 79-year-old gentleman who's had a witnessed cardiac arrest at home.
Jack wants to consult with the senior doctor on call before he decides whether to go ahead and use it.
Giving him a small amount of midaz, so 3 milligrams, just to try and flatten him out a little bit. So the call is to discuss potentially to add rock over the top of that to facilitate kind of a safe extrication and get him off to hospital. Let's try the SIMV first, no problem. Yep, sounds good to me. Thank you very so much, Neil. Have a good day. Take care. Bye-bye.
For now, Jack will keep David on the ventilator at his current level of sedation.
Have you got a full cylinder there, guys, or a nearly full cylinder?
We've got a spare one on the other side.
Perfect. So if we pop that on the where yours is, yep. So what this will do is it will support the breaths he makes, and it'll add a coupling over the top. I'm happy if we want to just break the scoop and we'll start sliding it underneath and get him packaged, but we'll obviously just keep it nice and steady, keep a close eye on him. Looks like he's fighting it a little bit, isn't he?
It's common for someone who has suffered a cardiac arrest and been resuscitated to re-arrest again on the way to hospital.
We'll get him strapped and packaged, we'll do one last check, and if we're happy, we'll extricate him out to the stretcher, get him onto the ambulance, reassess him there. The way he's going, I probably will end up giving him some rock on the back of the vehicle and just making sure we're settled for the transfer. But if you're happy now, we'll get him out. I'll grab the vent and the monitor. 1, 2, 3. OK, just watch out for all this. Is nice, slow time. If you keep coming forward, we'll get out behind you. Nice and high there. So just grab make sure I've got the little yellow handbaggy thing with the drugs in it, which should be on the chair, and the red bag. Is that all right? Thank you. All right? Nice and slow.
On board the ambulance, Jack makes his final checks.
That's right, so we've got airway. We've got RGL size 4 on a circuit that's working. He seems to be tolerating it fairly well. I'm not convinced that he's not making very effective rasps. He is breathing for himself, but they're not particularly strong. On that basis, I would feel more comfortable taking over and giving him the rock.
7.8, I think it was.
Having weighed up the risks, Jack decides the safest course is to take over David's breathing entirely.
So once I give him this, obviously he won't make any movement, he won't breathe for himself, but it's really important that we keep an eye out for things like tearing, tachycardias, and a raise in his blood pressure, because those are things that are going to indicate maybe some awareness. OK, so I'm going to give him the rock now.
Once the neuromuscular agent has taken effect, David is now effectively in intensive care conditions. His body unable even to breathe by itself.
60, thank you. We're about to leave for Heartlands. If you're ready for an atmist. He has now had, in total, 8 milligrams of midazolam, and I've given him the 50 of rock, because he was struggling to fully synchronise with the ventilator in the end.
Before they set off to hospital, Jack updates the trauma desk on David's condition.
We will be 8 minutes to Heartlands received.
Yeah, sorry, 8 minutes to Heartlands.
That is affirmative.
Leaving one of the ambulance crew members to drive his vehicle, Jack will not leave David's side until they arrive at hospital.
All right, David.
Well done, David.
We're off to the hospital, sir. So just become a little bit hypertensive again. So we just want to make sure that that's not any awareness. He's not becoming tacky.
En route, Jack and the ambulance paramedics keep David under close observation. The slightest fluctuation in his blood pressure could be a sign that his heart is about to stop beating.
You've got some global ischemia, but that's normal. That's for reperfusion, so I'm happy with that.
Arriving at hospital, Jack can deliver his critically ill patient to the waiting cardiac team in intensive care.
Skills that we provided there were the sedation, the advanced ventilation, the paralysis, the management of that post-ROS patient who's potentially very unstable, although he did quite well, and make sure that he was handed over effectively ready for ITU. So we had an airway in place. He wasn't aware of what's going on, he wasn't distressed, he wasn't in pain, and we were able to effectively put him onto an advanced ventilator and ensure that his physiological needs are taken care of. The plan now, hopefully, will be to head back to base, restock, maybe have a cup of tea, but we've still got a couple of hours left of the shift, so I could end up going to anything in that period of time. We're just hoping for a slightly more sedate last few hours, but we'll see what comes through.
The critical care team in the West Midlands are on the road 24/7, 365 days a year.
No problem at all.
At night, the car is crewed by a hospital doctor and a critical care paramedic.
Do you know any raps? Yo, my name is Tom and I'm very woolly.
I'm a bit of a bully, yeah.
Oh, perhaps not that one.
Dr. Tom Woolley is a hospital doctor who works 16 shifts a month for the critical care team. Ryan James is a full-time critical care paramedic, working an average 4 shifts a week, day and night.
I think I'd struggle to work within a hospital environment, certainly in the winter months. You go into work, it's dark, you spend all day under artificial light.
And you don't get to go to these fine dining establishments.
No, you don't get to go to the chicken outlets.
Ambulance service. Is the patient breathing?
Yes, it's me. I don't feel my foot's hanging off. Blood everywhere. My foot's just, it's just detached. I can feel the bone sticking through.
All right, we're not far now, okay? A couple of minutes.
In Walsall, Dr. Tom Woolley and paramedic Ryan James are en route to a code red emergency.
We're going to a 71-year-old lady with what sounds like an open ankle fracture, so there's break to the skin. There's a paramedic crew on scene, and they've asked us to come and assist with them.
Open or compound fractures can have serious complications and need urgent treatment. Wounds are easily infected, and disrupted blood flow can cause long-term damage to limbs.
Just ahead, keep left.
Tom and Ryan are only 2 miles away.
If it's a really nasty, deformed ankle fracture and she hasn't got any pulses in her foot, that might be another reason why they might want to call us to try and realign the fracture.
6 minutes later, Tom and Ryan are on scene.
Reached your destination.
Gloves.
Hello. Hello.
Hello. What's your name?
Sandra.
Sandra.
Hi, Sandra.
Can I have a little look at your foot, okay?
71-year-old Sandra has broken the 2 biggest bones in her ankle.
That's a decent fracture, that is, isn't it?
The snapped shards of her tibia and fibia have speared straight through her flesh.
I remember getting across the floor, and all of a sudden my foot was hanging off.
She had a mechanical fall, 6 o'clock.
Yeah.
She managed to crawl out of there,
Yeah.
so call 999, then call back.
Sandra was in such agony after her fall, it took her 2 hours to drag herself across the floor to reach the phone for help.
Sandra,
Yes?
can you feel me touching your foot there? You can.
It's a horrific injury, but Tom is concerned there may also be unseen damage to her nerves, and that could result in her losing the foot.
How's she coping with the Entonox?
Sandra's been given gas and air for immediate pain relief.
Just hold on to that, pop it on your face, and just take slow, steady, deep breaths, OK? Make a full seal.
But what Ryan and Tom need to do next calls for something much stronger.
And you've got IV access, have you? Yeah, and that's working all right, is it?
About a third attempt. Do some of the good stuff as well, Jill.
Before they can move her off the floor, Sandra's shattered ankle must be realigned. So Ryan gives her liquid morphine to help dull the agonising pain as Tom pulls the bones back into place.
Sorry, Sandra. Nice deep breaths for me.
Nice deep breaths,
Well
Sandra.
done.
That's it, well done. Nice deep breaths. Nice deep breaths. Keep going.
Well done.
Doing a great job. Deep breaths, Sandra. Don't hold your breath, sweetheart. That's it. Nice, steady, in and out. Big, deep breaths. Well done. Do you want to split it off
let's
first?
do that first, yeah.
The worst part may be over, but they still have to lift the injured ankle up off the floor into a temporary splint.
Well done, Sandra. You're doing really well.
While maintaining the bones in their correct alignment.
Apologise. You're doing really
happy?
well.
Yeah,
Really
all right.
well.
OK, well done, Sandra. Well done, darling.
Sandra. Just keep taking that gas as well. Keep taking that gas.
Nice, long, deep breaths, Sandra. Well done.
Tom and Ryan now need to work with the ambulance crew to get Sandra to hospital as quickly as possible to prevent any further damage to her foot.
We'll get the stretcher in, scoop off the floor and get her on, shall we?
Yeah, yeah. Just take some breaths of normal air in between. Is it still really sore? Just a bit. OK, all right. So you just lay where you are. We're going to get you onto a stretcher. We need to get you to hospital because you've broken your ankle and it doesn't look particularly great.
the bone's, it's an open fracture.
That's right, it's an open fracture.
It's been infected, is it right?
So we need to get some antibiotics into you and we need to fix it for you, okay? She's got quite a nasty looking open ankle fracture. What that means is the bone protruding. And so because it's quite a lot of damage to the skin around, we're going to take her to the QE in Birmingham, which is a major trauma centre, rather than the local hospital, just because she might need orthopaedics and plastic surgery potentially.
While Sandra gathers her strength for the next part of her ordeal.
Are we going to get around this corner?
I think we're going to struggle, to be honest with you.
Yeah.
Ryan and Tom need to work out how they're going to stretcher her out of the house.
It's getting through here, isn't it? Or back in there, because we can't even go in there, so straight in here.
What if we go blue carrier sheet and then we can get around the corner?
The only option is to bring Sandra out on a flexible plastic sheet. But the extra movement that will involve means Sandra must prepare herself for more pain.
Sandra, listen to me, sweetheart. We're going to slide you into your hallway, and then we're going to open the door, and then we're going to have to manoeuvre you a little bit out of the front door, OK?
It's fine.
Yeah.
Come towards me. Now, Pecky.
Hang on, sit up, guys. Hang on, that's it. There we go. All right. Is that OK? Do you think you'd be able to put your hands on the floor and then shuffle your bottom to the right-hand side? Do you think you'd be able to do that? Well done. Take your time. Is that OK?
That's it, well done.
Lie yourself back down now. OK.
Oh.
We're just going to put some more pain relief in your hand, all right?
Sandra's played her part brilliantly. Now it's up to the ambulance team to complete the extraction as quickly and painlessly as possible.
All right? You OK?
Yeah.
Any new pains or anything like that?
No.
OK.
OK.
Happy, Tom?
Yeah, on 3, 1, 2, 3.
You're just going to try now, all right? Bear with us. Everyone happy?
Yeah.
On slide. Ready, set, slide. OK. Well done, Sandra.
OK, we're clear.
You OK? Keep your head up, sweetheart.
That's it, well done.
OK.
Yeah.
Right, shall we lower down there, everyone? Yeah. And we'll just pop her on the stretcher. On lift, everyone. Ready, set, lift. OK, walk forward. Keep coming, keep coming, keep coming. And lower there. Well done, Sandra.
It took 10 milligrams of morphine, some gas and air, and a lot of courage on her part, but Sandra is now safely on the ambulance.
Nice to meet you, Sandra.
Yeah.
I'm getting off now. This gentleman's going to look after you. Nice to meet you, chap. Catch you later.
Knowing their patient is in a stable condition, Tom and Ryan are happy to leave her in the care of the crew for the 14-mile journey to hospital.
The ambulance crew will take Sandra to the QE. They'll hand her over to the emergency department there, and the emergency doctors will then speak to the orthopaedic team about admitting her to hospital for further treatment and probably need surgery on that ankle.
In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
accident is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got one male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
just need to check.
to stabbings.
You're going to put some oxygen on your pal?
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, 2 lives are in danger after a double stabbing.
Life-threatening, potentially life-changing.
A pedestrian is run over by a bus.
He needs the pelvic binder on. Yeah, because if he's bleeding, we need to stop him bleeding before we start replacing anything.
Matthew, open your eyes.
A driver collapses after a high-speed crash.
He's just not responding to pain. We're going to put him to sleep.
Can you hear it going on?
And a man is left battling for life after a city centre fight.
Seven 7062.
7062, good morning.
7062, good morning. I'm here. You can book me on here all day.
It's the start of a 12-hour shift for critical care paramedic Jack Lewis.
I am relatively apprehensive about what we're going to get today. I was on the trauma desk yesterday, very, very busy. This car particularly, with a range of stuff from quite nasty trauma to some unfortunate medical incidents. I think we're going to be the same today.
Ambulance service, is the patient breathing?
He's just been stabbed.
Okay, what have they been stabbed with, do you know?
A knife.
Okay, are they bleeding heavily?
Yes.
And how old are they?
An adult.
Do you know where the stab wounds are?
One's got one in the stomach, one's in the chest, and one's in the stomach. The one's got 2 stab wounds, he's losing consciousness.
Even if he's lost a bit too much falls of blood?
It's close to.
Okay.
Can you just send an ambulance,
Yeah,
please?
it's not delaying any help, sir, okay.
62 Whiskey Romeo.
A stabbing is one of the most challenging situations a critical care specialist can face. If an artery has been severed, a patient can bleed to death in minutes.
Been deployed to reports of a double stabbing, 2 patients, one with chest injuries, one with chest and abdominal injuries in a park not too far from the QE, so hopefully it'll be a case of a rapid assessment, major hemorrhage or life threat control, and then a rapid extrication. 60, thank you. ETA approximately 3 to 4 minutes.
The critical care team in the West Midlands deal with more than 30 stabbings every week. Reducing the number of deaths is one of the service's main objectives.
Police en route. So you'll be first on scene.
Roger, that's all copied.
We are having updates to scene with these patients are unconscious. Police today, their ETA was 2 minutes.
Roger, given the severity of their potential condition, I am happy to make scene with a dynamic risk assessment received.
With 2 patients' lives on the line, every second counts.
Updated report from police has come through that they're both unconscious, so potentially this is going to be 2 traumatic cardiac arrests. 60, that's all copy, just pulling up behind 4634 SRMA 55 now.
On arrival, it's a major incident, with multiple police and ambulance teams already at the address.
Hi, Rob. Yeah. Roger.
2 neighbours have been attacked. Simon, who's outside, was stabbed while trying to defend his friend. 41-year-old Matthew, who has collapsed in the stairwell, has been stabbed twice.
Come on. Breathe. Come on, deep breath out. Come on, you can. Okay.
He is struggling for breath. The stab wounds are close to his lungs, and they are in danger of collapse.
They put Kettle on, I've not looked at wounds.
That's fine. Is he on O2, Jaime?
He's on O2 from police, not ours.
The wounds have been sealed, but with internal bleeding and potential organ damage, he's at high risk of going into cardiac arrest.
GCS 15, chest seal applied, oxygen on. We're just going to get him gone and gone. He's got a good chest wound and a good abdominal wound.
All right, we'll put him straight on 4634 because the crew are with him. The second crew, I haven't seen this guy's wound yet, but it's abdominal.
I'll have a quick
so I'm going to get this crew to bring their stretcher up and we'll get this guy's...
If we just load it both and just get them all just gone straight off. I'm just going to grab an apron because I'm half PPE'd.
Once in protective PPE, Jack can make a close assessment of the other victim.
Rob, whilst they're dealing with him, I'll just have another look through this guy.
54-year-old Simon has one small but potentially deadly incision.
All right, can I have a little look, sir?
Oh. You okay, mate? You okay?
Okay, good.
You're all right.
It's a bit of bowel, but...
You okay?
It looks little. It looks like there's too much there with the lots of vein to it. It looks potentially out his bowel, but...
The stab wound has gone so deep, his bowel is now protruding out of his abdomen.
You okay, mate?
Okay, good.
If his bowel has been cut, he's in grave danger of sepsis, which can lead to organ failure.
So, hello, sir. My name's Jack, okay?
Oh, yeah.
Do you have any pain anywhere else? Have you been hurt anywhere else?
Yes.
Can we get this bag off you? Is that all right? Are you happy?
Yeah.
I'm going to get this top off you, mate, okay? Just to check and make sure you've been stabbed anywhere else, all right? Okay, let's have a look in your arms. Nothing in the back. You definitely weren't stabbed anywhere else? No, there's obviously bleeding, there's nothing into the wounds. Fine. Okay, good.
Right.
Yes, happy for this gentleman on your stretcher. Is that the plan, Rob?
Let's get him, because the sooner he's moved...
Yeah, let's go.
Suddenly, a fight breaks out amongst the bystanders, threatening not just the care of the patients, but the safety of Jack and the ambulance crew.
Ambulance service, is the patient breathing?
I don't know, though. I think he's underneath the bus.
Someone's been run over?
Yeah? Is the fire engine coming as well? Because they might have to lift the bus up.
Yes, I have requested for fire as well. Hello, I'm actually a nurse. I spoke to the gentleman under the bus. He said he can breathe. However, his arms are trapped. He can't free his arms to get from underneath the bus. Okay. We are coming to you on a blue light response and we'll be with you as soon as possible.
With a man run over by a 12-ton bus, the risk of catastrophic injuries is huge. So critical care paramedic Colin Apps is immediately dispatched.
The colleague, just so you're aware, so it's coming through as one patient. Man is still conscious, but still trapped underneath the bus. You have got a crew in attendance, and OM is about to book in as well, over.
That's all copy, thank you. We're about 8 minutes away at the moment. Helicopter, helimed is going as well.
He's not trapped under the bus. His ankle is touched by his head.
Sounds like he's going to have some injuries, doesn't he?
The incident is so serious, the air ambulance has also been scrambled. "12 minutes after receiving the call, Colin arrives and is briefed by the operations manager overseeing the incident.
He's just been trapped underneath this bus here. Yeah. His ankles were literally by his head.
Yeah.
This is as tight as you could get the bus.
Okay.
And we literally just have to drag him out. It's literally full drum and half under
GCS 15 still? But...
GCS 15, yeah.
And you don't think he looks very well?
uphill and climbing from what we could see. We couldn't get any answer them. So we literally just got them out.
Thankfully, just before Colin arrived, firefighters were able to free the man and he's now being assessed by paramedics.
Has he said he's got any pain anywhere?
In his arm. Where's your pain?
Andrew, relax his arm. Guys, take his clothes off completely. Get full monitoring on him. We need an ECG on him so we can monitor his accurate heart rate. Yeah. All right?
We've got a blood pressure ESM. Yeah, 101 over 69. Good radial as well.
44-year-old Andrew was travelling to meet his wife when he stepped out in front of the bus.
He needs the pelvic binder on. Yeah, because if he's bleeding, we need to stop him bleeding before we start replacing anything.
Although Andrew is conscious, Colin is concerned. If he's broken his pelvis, he could have life-threatening internal bleeding.
So he's got no bleeding under there, but his leg was, you say, quite up above his head, yeah?
By his head, yeah. It's kind of bent over onto this leg was above there.
As a catastrophic internal hemorrhage can cause death within 5 minutes, Andrew's in need of urgent transfer to a major trauma centre.
60, could you just update me? Is HeliMed en route over?
How old are you, sir?
54.
In Birmingham, critical care paramedic Jack is working to save the lives of 2 men who have been stabbed.
So I've got no odds on him other than he's got a good pulse. He's looking a bit pale, as you can see. Single isolated wound.
With 2 patients on his hands, Jack decides Simon is in the most stable condition for the ambulance crew to take over.
I've not taken his trousers off. It looks like there may be some bowel there. There's like a nice vein through part of the flesh, so it could be quite fatty, but I'm not prepared to say it's not bowel.
Yeah, no, sir.
All right.
The other victim, Matthew, is still in the stairwell and in more urgent need of Jack's critical care.
I can travel with either. Probably this chest guy. I'd probably stick with him because he's going to be the sicker guy.
A bit longer, and if there's anything going to go wrong, it's going to be with.
Yeah.
Okay.
I'm guarding these for their safekeeping. Please do not say anything. Stay there.
With tensions running high, police officers make a cordon to shield the paramedics from harm.
You guys have to get him on, and I'm going to start drawing up some TXA. Stand by. Life-threatening.
Life-threatening, okay.
Potentially life-changing. Yeah, you get him gone, get him gone.
Get him onto the truck, yeah?
I'll meet you there. Yeah.
So the dog ambulance can take you down to the ambulance.
It's vital Matthew is kept as calm as possible. With 2 deep stab wounds, any rise in blood pressure will increase the speed of blood loss and he could go into cardiac arrest. With a police dog escort as protection, Matthew is quickly evacuated to the safety of the ambulance.
Let him go now.
Yeah, I know, yeah.
Try and get these doors shut. Yeah, I'm going to get them.
Sorry. 6-2, go ahead. Very disordered scene. Can you pull yourself forward, mate, with my help? Matty, give us a hand. Now push yourself as far back as you can and get yourself sat up nice and high for me. Get your legs plied in, you've got good movement. You're doing really well. I know this is a really distressing time, but we're going to get you through it, all right?
Once on board, Jack gives Matthew a vital injection of tranexamic acid to try and stem the blood loss before updating the trauma desk.
I can't breathe.
So I have got a 41-year-old male. We've got 2 wounds. Okay, 1 non-sucking chest wound to the right anterior and 1 wound to the right lower quadrant.
They will alert the hospital to expect 2 critically injured patients who will need urgent surgery.
He's had TXA oxygen applied. The other patient is on the other vehicle. He has an abdominal wound, potentially a spat of small bowel visible. We are leaving scene now for the QE. ETA approximately 6 minutes.
While travelling on blue lights, Jack closely monitors critically ill Matthew.
Is that pain a bit better? Yeah? Feel a bit easier? Good. Are you able to take a deep breath in for me? And out. Sore on that side? It's all right, I know, I just need this chassis to stick a bit. Otherwise it's not doing a huge amount. I don't think you damage your heart, I think it's your lung, essentially, or the space where your lung should be, okay?
When the call came in to say we had 2 patients both stabbed, potentially both unconscious, I'm thinking traumatic cardiac arrest. I'm going to have to really prioritise who's going to get my help first.
Yeah, just twice. Yeah.
The trick with these patients is get going while the going's good and don't waste time. We're not going to fix their problems on scene. If they arrest on scene, we're in a whole world of trouble.
30 minutes after the emergency call was made, both stab victims are handed over to the major trauma team at the Queen Elizabeth Hospital, Birmingham.
Either of those wounds could potentially kill someone. The gentleman that I was with, he had air in his chest that was taking up space that lungs should have been taking up, so compromising his ventilation. The other gentleman, if he's nicked his bowel, that can be really quite complicated. Both are going to be at least life-changing and going to require significant recovery.
You got pain here? Pain there?
In Dudley, critical care paramedic Colin is dealing with a major incident at a bus station.
Do you take any medicine for anything, Andrew?
Epilepsy.
Epilepsy? OK. You haven't had a fit at all, do you know of?
No.
Andrew stepped out in front of a bus and was trapped under it for more than 20 minutes.
We'll get morphine on the truck if you guys are up there. Yeah.
Yeah, we'll just give the IV paracetamol for now.
Paracetamol going in, guys.
Andrew, you still here?
Yeah.
Good man.
Colin is concerned he may have life-threatening internal injuries.
Can we grab another crew?
Andrew, where does it hurt?
Just sat down, just feeling pretty shaky. In your shoulder. In your shoulder is there.
So is it you had the TXA, or was that just being drawn up here?
Colin gives Andrew tranexamic acid to help stop excessive bleeding.
Just chuck it over this side, I'll pop it on this side.
Although they've managed to stabilise Andrew, they need to get him to hospital fast.
7062, what's Helimed's ETA now over?
Colin checks the whereabouts of the helicopter.
What do you think about leaving scene to the QE? Because I don't think Helimed's going to do anything extra now.
No, it's BP 91 over 6.
It's come up a little bit, so don't worry about the fluids for now, we'll do it on the way.
Rather than wait for the air ambulance, Colin and the crew decide it would be best if he escorts Andrew to hospital by road.
Nice one. Thanks, guys. See you later.
A patient with internal injuries can suddenly deteriorate, so Colin's critical care continues throughout the 20-minute journey.
How's your pain now? Does it hurt anywhere? What happened? Do you remember?
At the Queen Elizabeth Hospital in Birmingham, Colin hands Andrew into the care of the emergency doctors.
Okay.
All right, Andrew. This is at the hospital there. All right.
Quite a serious job, especially in terms of the mechanism and potential a serious injury. I suspect he's injured something, I'm not sure what, which is why he's having a CT scan so he can find out. In terms of his observations, he didn't seem terrible, but I'm sure he's got something wrong with him.
As night falls, there is no let-up for the critical care teams.
So just have a check that there's nothing that's out of date.
At base, Dr. Ravi Chauhan and critical care paramedic Richard Apps have just checked in for their night shift.
It's not going to be a normal hot Friday weekend, and I think that's just because of what's happening with COVID, with lockdown and social distancing. But I suspect today will be probably quiet to begin with, and then maybe some RTCs.
I think you're being very optimistic that people are still behaving with lockdown. I don't think they've behaved for weeks. They've all gone mad. Job numbers are all back to stupid again now.
It's not long before Richard is sadly proved right.
service. Is the patient breathing?
I don't know. There's been a fight. He's dead cold by the looks of it. Somebody's having a right panic. You need to get somebody in straight away. Can you hear it going on?
Yeah. Okay, so male adult.
Male adult by the looks of it, yeah.
And you said that he seems unconscious.
He's dead cold, love.
Have you got an idea what's happened at all?
It looked like it was a fight. It all happened really quick, and then all you heard was this crack. And I'm reckoning his head on the tile floor. He's bleeding. Or he's sick. Or he's being sick. Whatever it is, it's not looking good. Can you hurry up with the ambulance, please? They're doing CPR. They're doing CPR on him.
They're doing CPR, okay. We are coming as quick as we can, blue light.
An ambulance has been dispatched, but the man's injuries are so severe he may be in cardiac arrest and in need of enhanced critical care from Ravi and Richard.
We are going to central Birmingham to reports of an unconscious patient following an assault.
500 yards. Hi, thanks. Just a quick update from the scene. There's a few crews in attendance. The patient you're going to has a GCS of 3. He was hit over the head with something. He has his pupils, trismus. They report the scene as being very chaotic. They're scooping the patient and loading him onto the back of the ambulance. They're going to try and get bilateral IV access ready for you.
Yeah, that's received. If they are having airway issues, I would suggest that they go to nearest whilst we make our way.
Yes, absolutely. They were still on scene when I spoke. I think, from what I heard, you are going to make scene before they're ready to leave. Received.
Yeah, many thanks.
The patient is in a life-threatening condition. He's deeply unconscious, and the ambulance crew already on site are struggling to get oxygen into him.
What they're reporting is trismus. Essentially, the jaw is locked, which means that the patient may not be able to get enough oxygen to the brain and to other organs. So if we're struggling with that, then we may have to act pretty swiftly. As you're probably aware, the brain can only survive so long without oxygen before you have irreversible damage.
I haven't seen the vent or anything. Just sort of pushing through these checks in case we get an early job.
It's 7 p.m. and Dr. Polly Haywood is getting ready to start a Saturday night shift.
It's payday this weekend, so we could expect it to be busy, but obviously we don't know if people are not socialising as much as they might do with coronavirus.
Tonight, she's paired with full-time critical care paramedic Sarah Foley.
Yeah, that's the third one. Have you checked it's got enough masks and stuff in, or...?
No, the blue kit.
No, I'll have a look.
So this is a brand new car, so we're just kind of familiarising ourselves with it. We've got burns kit, maternity kit, including the slightly unlikely nerve agent protection. We've got snow socks. I hope we don't need those.
I don't think so.
Midlands service. Is the patient breathing?
Yes.
Are they conscious, awake?
No.
He's not responding to you.
He's not responding, no.
If you gently take his shoulder, does he wake up in any way?
May, can you wake up for me? May, can you wake up for me? No, he's not.
Okay.
He's been in a car crash, and a very big one. By the looks of it, he's lost control and is driven into a lamppost and then a tree.
Okay.
He was up and around for sort of 5 minutes. He lay down and then he sort of passed out through.
Okay. We are coming to him on blue lights.
A man suddenly collapsing after a high-speed road collision is a Category 1 emergency. An ambulance has been dispatched, but critical care backup from Polly and Sarah is also needed.
The patient has driven into a lamppost, then a tree. Only him involved. Patient was walking around after the RTC, then lay down. When you crash into motorway furniture or lampposts, they're all designed to deform. A tree is not designed to deform.
With over 1,700 deaths on Britain's roads every year, the team have to be prepared for the worst.
Hi guys, high speed RTC, still GTS 3. He's got some contusions to his head that might possibly be isolated head by the sound of it. Blood pressure 134/82. Making him a screw to get, but they're quite busy on feed.
That's absolutely fine. Just keep us updated before they leave the scene. It sounds like patient would require an RSI.
Sarah and Dr. Polly are highly qualified to perform an RSI or roadside anaesthesia should it be needed.
Is there enough space in here? Yeah, I think there is, yeah.
When they arrive, the injured man has been moved to the ambulance.
Right, we're both going to have to dial level 3, aren't we?
As Polly and Sarah may need to put a breathing tube down into the man's lungs, they both must wear the highest level of protection against coronavirus.
So, really fine mechanism. It's a bit weird. Something that's quite adamant, to be fair.
While they dress, the paramedic updates them.
And he's come out of the car. He's been walking around for about 5 minutes apparently.
Yep.
Witnessed by bystanders.
Yep.
And he's just collapsed. So he's been GTS 3 with us.
A GCS, or Glasgow Coma Scale assessment of 3, is the lowest level of consciousness and a sign of possible brain trauma.
Hello, buddy.
Now in COVID protective suits, Dr. Polly and Sarah begin their close assessment of the patient.
My name's Dr. Hayward. I'm one of the merit team. I'm just having a feel across your chest wall, sweetheart, OK? He's got like a laceration there.
Yeah. So anything to suggest that he's under the influence of anything? What's that?
Bit of a lack there, like a seatbelt lack. He's got a very firm belly, but all his numbers are normal.
Completely perplexed.
Although the man is unresponsive, his vital signs are good.
What's his name?
Matthew.
Matthew, have you taken something? Hold your arms up for me, buddy. Hold your arms up. See, there's tone in there. Hold your arms up. OK, hold it up there for me, buddy.
To assess Matthew's brain function, Polly checks his arm reflex.
This is all very odd, isn't it?
Yeah.
If he's unconscious, his arm should fall totally limp without any reflex. But as she drops it, Polly can feel the muscle tense, which is very unusual for someone unaware of what's happening.
So it seemed to walk at scene, but then...
Yeah, he got out of the car for about 10 minutes, was complaining about pain in his back, was fixated about finding his phone, and then by all accounts he sort of sat down on the edge of the road and then collapsed and was in this state from that point.
It's a mystery Polly needs to solve fast. Time could be running out for Matthew.
Let me just have a listen to his chest. There's nothing here on his numbers that makes me want to put him to sleep.
Dr. Ravi and critical care paramedic Richard have been dispatched to Birmingham city centre, where a man has been seriously injured after a fight. He's now on an ambulance. The crew brief Ravi.
What's going on? Yeah, this is Julian. He's assaulted in the head.
Yeah.
I'll step out of the GTS 3. Yeah.
32-year-old lorry driver Julian was on a night out when he tried to intervene in a fight. He was punched and fell to the floor. He's now fighting for his life.
Whether CPR was started or not.
Yeah.
There's a lot of commotion.
Yeah.
His right ear has got serial levels of congealed blood. Pupils, left side sluggish in 3s, right side was reacted in 3s.
Julian is completely unresponsive and bleeding from his ear. All the indications are he has suffered a traumatic brain injury.
He's trismus. We couldn't get an OPA in, so we popped an MPA in on the left-hand side. Stats were 92 on air, they're now 100% on 15 litres. Got bilateral access. He's been blood pressure stable throughout, and we've given him 1 gram TXM.
Brilliant.
Julian's jaw has locked, so the paramedics have inserted a tube through his nose to get vital oxygen into him and keep his heart and other organs functioning.
Looks like gentleman's been assaulted and seems deeply unconscious at the moment. So Ravi's just going to assess him, but we may just travel as we are because we're not that far from the hospital and reassess on the way.
You might as well tell him to get ready.
Yeah.
Julian needs all the skills and resources of a major trauma hospital. As the Queen Elizabeth is just 10 minutes away, Ravi decides this is the best option.
Hi, it's Ravi. So can you just put a quick alert to the QE to say that we're going to be there in a couple of minutes with a GCS3 head injury, observation stable, and have anaesthetics on standby. So we're not going to RSI here, but you'll probably need us. Okay, cool. All right, so that's bye.
Having updated the trauma desk, Ravi monitors Julian closely throughout the journey, while Richard follows the ambulance, ready to help should his condition deteriorate further. At the hospital, Julian is taken straight into the emergency department for ongoing trauma care.
It's difficult with these conditions and these incidences to determine what the outcome's going to be. Because I work in the intensive care setting, this is something I see quite regularly, and there are people that come in very unconscious that wake up and walk out of hospital 12 hours later. And on the other end of the spectrum, you've got somebody that's severely disabled that needs care for the rest of their life. Until the hospital have done the scans, they've given him some time to recover, you know, we won't really know what his outcome's going to be.
In Oldbury, critical care paramedic Jack Lewis is making a mid-shift pit stop.
Never know how it's going to pan out doing this type of work. Could well get 1 or 2 more jobs before the end of the shift, but in case we don't, it's about kind of preparing, taking the opportunity while we can to get the car ready for whoever's on tomorrow, who might be rushed first, you know, out first thing. So we've still got a couple of hours left for things to happen.
Ambulance service. Is the patient breathing?
No, I don't know. An old man's just dropped and collapsed on the floor. His head, heavily bleeding from the head.
Is he making a grunting or?
Yeah, definitely.
Yeah. Okay, is he awake?
Hello? Hi. No, you're not awake.
No response. We've got the help on the way for him, okay?
CKG Bell 2144, please come through the Cat 1, unconscious, noisy breathing. ETA is about 10 minutes, please.
Roger, all copy, no worries, I'll give you an early update. Thanks, ETA approximately 3 minutes.
A man who has suddenly collapsed and reportedly unconscious is part of the reason the critical care team was set up.
We're about a minute out, we'll probably be first on scene. There's a crew also en route, but they're probably about 8 minutes behind us.
They are highly trained, able to administer life-saving treatments at the roadsides over and above regular ambulance teams.
Male in his 70s, unconscious, sounds like a collapse. Patient collapse, hit head. Hi guys. Hello, my name's Jack from the Air Ambulance. How are you? What's your name? Tony. Do you know what's happened, Tony?
Tony, a retired engineer, was on his way to his local shops when he fell and hit his head on the pavement.
Do you remember what's happened at all? No, you've banged your head, you've given yourself quite a clock, I think. Yeah, have you got any pain anywhere? Nothing at all? OK. So you don't remember what's happened, you've been seen to walk down the street and you've gone down and you've clocked your head. I can see you've got a nasty wound to your head there. Do you think we can try and roll you onto your back, sir?
I've got some shopping to do.
That's OK, we can do that a little bit later. Let's make sure you're well first. OK. Can I give you a bit of a check over, Tony?
Yeah.
Although Tony has regained consciousness, he has no recollection of what's happened.
Yeah.
How old are you, sir? Give me a rough idea.
64.
64. And do you suffer with any medical problems?
Nothing.
Nothing at all. Do you take any
He's
medicine?
also very confused. Tony is 75 years old, not 64.
Or sit up next to you, it's whatever you'd rather. Do you think we can get this jacket off? I think you're probably a bit warm.
No, I'm all right.
It's 27 degrees, and Tony is dressed for winter. Overheating may be one reason for his collapse.
Let me come behind you. Sit up for me. Good, ma'am. Tony, can we get this jacket off? Just give you a bit of a check over. Have you had much to do? Any food, lunch today? Anything to eat? No. Much water? No.
Jack needs to be sure there aren't any other underlying causes, particularly seeing he already has another recent head injury.
Do you take any medicine to thin your blood? No. OK.
Tony's displaying some concerning symptoms.
Do you take any medicine for anything at all? Nothing. OK.
His sudden fall, difficulty speaking clearly, and confusion could all be signs of a stroke.
Very flat, isn't it?
In Shrewsbury, Dr. Polly and critical care paramedic Sarah are dealing with a puzzling case.
Buddy, come on, matey.
Matthew has had a high-impact car crash and appears to be deeply unconscious. But Polly thinks he may have some awareness, and for an unknown reason, can't move or respond to her.
Inside of the vehicle.
Have we got big intrusion? He has got a shift there, isn't he, into the centre console?
Into the back and there.
To try and establish what might be causing Matthew's paralysis, she looks at photos of the crash to see if she can glean any clues.
By all accounts, he was into a lamppost, then onto a tree.
So with those scene photos, we need to go to major trauma centre. The options are we tube him, or we take him straight and we tube him if necessary. His numbers are perfect. He looks good. He had voluntary swallow. Been watching him swallow.
Just not wanting to respond to it, is he?
No.
Having examined the scene, Polly suspects Matthew has internal injuries. She tries one last time to wake him. She gives his skin a sharp pinch to see if he has any response to pain.
I think on paper we are GCS3. I have given a really big painful stimulus.
Big mechanism.
Big mechanism of injury. He's got voluntary eyelash reflex. He's got some swallow. Yeah. But I've given a very painful stimulus and no dice. Right, we'll go to Stoke, walk us into sleep.
I'll just tell the OM exactly what we're doing and I'll set it. Hi, you're right. So it's a long journey to Stoke. We're going to put him to sleep. There's something doesn't add up here. He's just not responding to pain.
We're doing the RSI here then, are we?
Yes,
okay,
yeah. Is that all right?
Concerned Matthew may have a brain injury that could have life-changing consequences, Polly decides to put him into an induced coma to reduce swelling in the brain, protecting it from further damage.
Our journey time up to Stoke is about 35 to 40 minutes. So we're just going to quickly pop him to sleep for the journey and then he can go straight into a CT scanner to assess him for his injuries. Although we can't physically see any injuries on him at the moment, he's not waking up.
Matthew! Matthew! I'm having a look at his airway. He's got a smallish chin, but that looks pretty reasonable.
There is always a risk putting a patient into a coma, but doing it on an ambulance, 35 miles from the nearest trauma centre, the stakes are so much higher.
We'll optimise our airway position.
So the ventilator's working, I'm going to turn it off for now.
And what have we got there? Ket, rock, a bag of fluid for flushes.
So I think we're pretty much there now.
The checks are done, drugs drawn up, Polly is ready to anaesthetise.
Oh, hello. Oh. All right, buddy. That's about on time.
When Matthew suddenly comes round.
Matthew, open your eyes. Hello, buddy. You're on the back of an ambulance, sir. Matt, open those eyes for me again. So we've had voluntary eye opening, that's great. Obeying commands, 9. Can you talk to me, buddy? My name's Dr. Hayward. We're near Shrewsbury, fella. You've been in an accident. Hi, Matt. I know we're dressed up like out of something like out of ET, all right, but you have had a period of being unconscious. Do you know where you are? No. So I think what we'll do is we're all ready to go. If we give you a nod, we can RSI on the way. There's no indications to put this patient to sleep.
As Matthew is now conscious and responding to Polly, the anaesthesia is aborted.
Have you got pain anywhere?
Everywhere.
Everywhere? Where hurts, fella?
your back and your neck. OK, sweetheart. So if you can bring that neck a little bit straighter, we're going to just tape you here to keep your neck nice and still, buddy, OK? Have you got pain in this tummy? Are you OK? Or is it in your back? Belly in your back. All right, sweetheart. Right, let's just leave sooner rather than later.
Matthew may have spinal damage. He needs an urgent CT scan to check for any fractures in his vertebrae, which could cause paralysis.
We have a 28-year-old male who was a driver of a car, high speed, impact into a lamppost and a tree.
Sarah updates the trauma desk on Matt's condition and to alert the hospital of their arrival.
Was a GCS of 3, but still had eyelid reflexes in the way of blinking when you touched his eyelids, but there was no response to pain.
Dr. Polly continuously monitors Matthew during the journey to Stoke.
Thank you. Got it already. Okay, all good, yeah, thank you. Okay, just monitor.
15 minutes later, the critical care team can finally hand Matt over to the waiting trauma doctors.
The pressure's good. You are quite tacky. I think you're probably quite dehydrated.
Critical care paramedic Jack Lewis is treating 75-year-old local resident Tony after he collapsed unconscious in the street.
Hello. Have a little bit of water for me.
He has a nasty head wound and may have a bleed to his brain or suffered a stroke.
This is Tony. So Tony's fairly regular fixture around here.
An ambulance crew has arrived to take him to hospital. Jack briefs them on his initial assessment.
He's walked down the street a bit unsteady, held onto that and then collapsed, fell to the pavement, hit his head, as you can see, with a brief period of LOC. On my arrival, GCS 14, sat himself up, no obvious neck pain, not complaining of pain anywhere else. Wound here, not actively bleeding, a bit boggy and a bit kind of angulated.
Right then, Tony.
We'll get you on a stretcher, Tony.
You on our stretcher? Legs together, that's it.
Ready to push? 1, 2, 3. Good man.
Tony needs an urgent scan and full investigation into the underlying cause of his collapse.
I'll pop you up to Russell's Hall to get your head looked at. Why? Because you've cut your head.
That's 3 or 4 days more.
It's not. You've done it today.
You've got a nasty bump as well.
Not today.
All the blood on the pavement says otherwise.
Jack knows there could be many reasons for Tony's confusion. Heat exhaustion, dehydration, or something more life-changing.
GCS 14 initially.
You don't remember falling at all?
Not today.
No. Okay.
Even more reason to pop up the hospital then. Need to get that looked at.
After updating the trauma desk on his assessment, Jack has done all he can for Tony at the scene.
Take care, Tony. Feel better soon, sir. OK.
And hands him into the care of the ambulance crew for the journey to hospital.
Certain.